Hello and welcome. Today we will discuss strategies to reducing your risk when phasing out of shelter in place. Our presenters this evening is Dr. Dianne Martin, an infectious disease specialist for the Washington Township Medical Foundation, and Mary Bowron, Washington Hospital's Chief of Quality and Resource Management. Without further ado, please welcome Dr. Dianne Martin and Mary Bowron.
Hello, I'm Dr. Dianne Martin, infectious disease specialist. It's a pleasure being here with Washington Hospital's Chief of Quality and Resource Management, Mary Bowron.
Hi, Dr. Martin. Thank you. My name is Mary Bowron, and I am a member of the COVID response planning team here at Washington Hospital, and we work every day to ensure that we have the appropriate policy and procedure in place that we can make sure to protect our patients, our healthcare workers, and our community for public health safety.
Mary, could you tell us a little bit more about the team and what they do?
Sure. So this is a team that we developed here at Washington Hospital even prior to the shelter in place, which took place on March 19th here in the state of California. We gathered together a fairly large group of multidisciplinary group that meets daily in the hospital. And this is a group of people that come together every day, and it's chaired by our CEO. And the focus is really, do we have everything in place that we need to prevent the spread of COVID, isolate to make sure that all patients are protected or isolated if they are considered a suspect for COVID. And the team really is a multidisciplinary team. It's made up of medical staff, nursing, infection preventionist. Another big focus is making sure that we have the correct personal protective equipment in place, otherwise known as PPE. So that team meets, we review literally every day how much we have of each part of the equipment to make sure that if something is coming up that we need to get more of, we can plan. And it's a great way to have day-to-day communication because, as you know, Dr. Martin, it's evolving day to day, and it changes so quickly that it's really important that this group of people come together to make sure that we're doing the appropriate, safest planning possible. So I've really enjoyed being part of it.
Good.
The other thing is that after shelter in place came into about March 19th, we put into place, of course, the measures that were similar to protecting the public, but the California state regulations required that people to shelter in place, meaning you stay in your house unless there's an essential task that you have to do, such as going to get groceries or required supplies. But what we've begun to see over the beginning of June is that now the state is opening back up, right? And there's certain areas and businesses that are opening. Like example, in healthcare, we've started doing elective surgeries again. And we've also maybe even started doing some patient-doctor visits in place. So, Dr. Martin, what are some of the things that you think we've put into place here at Washington Hospital that even meet and exceed the standards of the Centers for Disease Control to prevent the spread and control of COVID?
So just like Mary is talking, our COVID-19 team has worked together to make sure that we approach both in the hospital and outside the hospital in a very organized fashion and make sure we're covering all the safety measures. So we pre-screen in advance of appointments, procedures, admissions, and entry into the hospital. By this, we mean patients coming in that are going to have procedures and patients coming into the emergency room. Usually this is done by a set of questions. Additionally, we do mandatory masking and temperature checks for everyone coming into our hospital. We do COVID-19 testing where appropriate. We also do isolation and dedicated rooms for suspected or confirmed COVID-19 patients. Also, patients with respiratory symptoms are directed to a dedicated area so that they're screened appropriately as well. In addition, we do rigorous cleaning of all of our hospital units, both inside and out, as well as in our clinics. We maintain supplies of personal protective PPE, as Mary was speaking, to ensure appropriate use. So we have been very fortunate in having somebody very dedicated on our hospital staff that's in charge of maintaining all of those supplies and making sure that we have appropriate supplies for both our intensive care unit as well as our emergency room and our outpatient clinics. We have hand sanitizers throughout the hospital, on the walls coming in, on the patient rooms, in the ER, in the OR, in all the clinics, and tissue boxes on all our sites. The other thing we do is physical distancing in all of our common areas. So whether it's a waiting room or on the nurses' stations, we're doing physical distancing in all of those areas. We also restrict the number of people coming into the hospital one by one, and also in our clinics. The other thing that's very unique for our hospital that we've started doing is the telemedicine. So either by video, phone, tablet, or computer, we're offering medicine visits. So if you don't have something where you physically need to come in, your doctor, PA, or nurse practitioner can visit you over the phone, over the tablet, or through the computer. We do remote monitoring when appropriate.
So I think those are all great measures, Dr. Martin. What are some of the best benefits to going and utilizing a service like telemedicine for a patient?
So telemedicine is very unique, and for many of us, it's also, like everything else, a learning experience. But what I found is the patients are very appreciative of the time that we're spending face-to-face with them. It's pretty widespread through all of our clinics, and it allows a certain amount of interaction with the patient. You can go over medications and symptoms, and they're allowed to dialogue. If a patient comes into our office, they're not allowed to bring anybody in with them unless it's an emergency. Whereas if you're doing it at their home, they have a spouse, significant other, or somebody who's a little bit hard of hearing or a little bit cognitively impaired, the other family member can really help bring comments and reassurance to the patient when they're talking to the doctor, either through video or conferencing or a tablet. So I think we get a very widespread approach to this. The other thing that we are very, very careful with is security. All of our channels are maintained with a secure channel, so all the communications are very, very secure. The health and safety of our patients has always been our number one priority, and that's why we've implemented these very important measures. Mary, from an infection control perspective, what protective measures should we take in a public setting?
Sure. I think a public setting is another area where we have to make sure that we're taking measures to protect ourselves and to keep our community safe. So there are quite a few safety measures that you can do while you're out in public. First and foremost, maintaining the physical distance of 6 feet from yourself and the people around you. So if you're in the grocery store, just making sure that most places now have a marking on the ground that kind of helps give you a visual cue, making sure that you're following those guidelines to stop the risk of the disease spreading to you. Another thing that the CDC now is supporting is that we wear cloth face masks when we're out. There's research that supports that sometimes even if you're not having symptoms of COVID, you can spread the infection. So if you're wearing a mask, this will contain any viral shedding that you may have, even if you feel well and don't have symptoms. Another measure is trying to remember to avoid touching surface areas as much as possible, right? So of course there are things that we have to do. You have to touch the ATM when you're out in public or things like that, but just trying to limit it to only necessary contact with surfaces in the public, because they can often be contaminated with a virus or bacteria. And it's important to remember that in between any contact with a surface area or after you've come back and left your public setting, to wash your hands. Washing your hands is the most effective measure taken to reduce the spread of any infection. And this is especially important during COVID-19 pandemic. So washing your hands for the full 20 seconds. You can use soap or water or any of the hand sanitizers that we see around so often, the alcohol hand sanitizers. Another thing is, people touch their faces so much, right? And now I think that we're wearing masks. It's less likely, but just to remember remember that not to touch your face, because that is one of the areas where you can transmit the virus from touching a surface area and then touching your face. So if you're not touching your face and you're washing your hands, you reduce the risk of anything you came into contact with while out in the public setting. And again, remembering that having just basic respiratory etiquette, cough, sneeze, keep your mask in place, or if you don't have on your mask, then cover your cough and sneeze by coughing into your elbow, not into your hand. Also, even though we are seeing things open up in the state, I think it's important to remember that we still do want to be staying at home as much as possible to reduce the risk, especially if you're in one of the vulnerable populations of patients, and keeping your area of your house and any area that you're going out with in your car, anything like that, keeping areas clean with disinfectant. This is something that you can't do too often. Cleaning and disinfecting all the surface areas around you really are as another great way to slow down and stop the spread of COVID.
So I'd like to bounce back onto that, because being at home is very, very safe. And many people get very afraid of coming into the hospital, into the clinics, and into the emergency room. And we want to emphasize that all of these places are very safe. I mean, we have a state-of-the-art emergency room that has all private units. We have a brand new ICU, critical care, again, all private units. In the hospital, all of our employees go through rigorous testing when they come in through the hospital coming to work. We all wear masks. We're all wearing gloves where needed, face shields where needed, washing our hands a lot. So I would like to emphasize being at home is the safest, but coming to the emergency room, to the hospital, to the clinics, to our labs, to the mammogram unit, all of the x-rays, those are equally safe, because all of the precautions that you're taking at home to be safe, we're also taking here. So we want to make sure that if there is a need for you to be evaluated in person in the clinic or in the ER or even in the hospital, we wanted you to know that it's extremely safe and we are taking every precaution possible.
That's good. And I think that in addition to that, it's just on maintaining your health, and like Dr. Martin is saying, not delaying your care and making sure that you're getting the care that you need when you do, in an environment that's really set up to be as safe as possible to prevent the spread of COVID. The other part is making sure that you're trying to do everything to keep your daily activity, right? It's a hard time right now to stay active. So one of the things that the state has done to support the need for the residents to stay active is allowing us to continue with recreation. So you can still go outdoors and exercise, and while making sure to maintain social distancing, visit the parks that are close to your home, but remembering to avoid peak hours and crowds during that time to try and limit the exposure to other people is also another health mechanism that I think helps right now to make sure you stay active.
Those are great suggestions. The CDC also offers printable resources in multiple languages that you're seeing on your slides now. So let's take some questions from our viewers.
Great. This question is for Mary. How risky is it to head out to the beach for a day?
That's a good question. I think that there has been quite a great deal of discussion around going to the beach, and the beach is another example of an outdoor activity that right now with our pandemic planning can be done with the proper precautions in place, such as making sure that you are wearing your mask while you're still out, that you maintain the social distancing of 6 feet from anybody who would be near in that area of the beach, and going with people that are in your family out to visit and people that you know and understand their risk, and being careful, especially with vulnerable populations going. So it's something we can do, but we just need to make sure the proper precautions are in place.
Great suggestions.
This question is for Dr. Martin. How do I protect myself and my coworkers at the office?
Just to sort of echo what Mary was also saying, even at work, we want you to do social distancing, wash your hands, wear the mask as much as possible. If there is a break room or lunchroom, then probably people should stagger themselves such that not everybody's in at one time. I know a lot of us working from home, when we have the opportunity to go back to work, we really want to socialize because we miss those people so much. But until things have continued to improve, we want to make sure that people still do social distancing, hand washing, and wearing the masks, even at work.
Okay, this question is for Mary. What precautions should I take when I go to the gym for a workout when the gym opens up again?
I think going to the gym is one of the areas of progression that we've seen recently in June, as we've seen gyms start to open up in a limited capacity. And the state of California has put into place very specific guidelines and expectations that gyms have to do to be open. And so there are certain things that you can expect when going to the gym and should do to prevent your risk of acquiring any infection, especially as COVID. First and foremost, when you go to the gym, they will be screening you for temperature and any respiratory symptoms, which I think is a great measure to avoid sick people arriving at the gym. So expect to be screened. Pay attention to all of the alcohol sanitizer that they have in place. It's frequently in a lot of places in the gym. So accessing that, making sure to perform your hand hygiene, cleaning and disinfecting the equipment before and after you use it is another important thing to do. And there are certain gyms also that you'll see a little bit more of outdoor classes to reduce the risk, and maintaining, again, that distance of 6 feet between yourself and anybody else working out at the gym. There are some unique ideas right now that gyms are doing, which is setting up sort of a dedicated area that an individual can have with the necessary equipment, go through, do their workout. That equipment is all cleaned at the end of use and ready for the next person who comes in. So it's good that we're able to see that more people will be able to get exercise now. It's great for the mental health benefits and the physical, but there will be precautions that are in place.
Okay, this question is for Dr. Martin. How do we keep our friends and relatives safe at a celebration, for example, a backyard barbecue for the 4th of July?
So that's a really good question, and it comes up quite a lot. And what I would say to most people, you need to plan in advance. So you want to figure out who's coming. Unfortunately, you may need to limit your group, so to maybe 12 to 13. And you also want to talk to them ahead of time, people that you might be inviting, see if they're comfortable with what you're planning. And I would not be upset or embarrassed or angry if they just say, thanks, but no thanks, I'd rather stay home. And there may also be people who want to come to your party that hear about it, and you're going to have to say, I already have a certain number of people. So the people that you're going to invite probably, again, need to be within your social group. So you know what risks they have taken, you know yours, and you're basically on the same level of risk taking. How many go out, how many go to work, and how many children they have. Do they have an elderly parent that they might be bringing to your celebration? I would take all of those things into consideration. The other thing is that basically we still go through the social distancing, the hand washing, the masks. Those still need to be a part of your gathering. So obviously when you're eating, you're going to need to take them off, but just for temporary. The other thing we want to do is make sure that you're plating or serving your food into containers or sizes so that they're not getting mixed up or multiple people are picking up things hand-wise, and probably limit things like finger food or hors d'oeuvres and serve things that are separated. And then again, I would do lots of hand hygiene, whether you get the little pumpers with the hand hygiene or the little special ones, maybe they're decorative for your celebration, to make sure those are available for everybody and placed widely. So I think you can have celebrations, you can go on with life events, but take in mind everybody, including your own safety for that.
I think those are great suggestions. So it's the new next step to a new norm, really.
Yes.
Thank you. Well, this concludes our program. Thank you, Dr. Martin. Thank you, Mary, for your expertise. And thank you to our viewers for tuning in. The entire broadcast of today's event will be available on our Facebook page later this evening. We look forward to hosting more Facebook Live events in the future.